Gentlemen, let me ask you something most men will never say out loud. What really happens to your body when you go months, maybe even years, without sex? Does your desire disappear? Do erections get weaker? Does testosterone drop? Can your prostate, mood, sleep, or confidence change? And the question many men over 50 secretly fear is, use it or lose it actually true? I'm Melissa Carter, a medical researcher focused on men's health, aging, hormones, prostate wellness, and intimate function. And today, I want to give you the honest answer. Because the truth is not as scary as some people claim, your body does not suddenly shut down because you have not been sexually active. You are not broken. You are not finished. And your best years are not automatically behind you. But there are real changes that can happen when the male body goes a long time without sexual activity. Some affect blood flow, some affect pelvic muscles, some affect libido, some affect confidence, and some may reveal deeper health problems you should not ignore. So stay with me, because by the end of this video, you will know what is myth, what is real, and what you can do to maintain vitality even if you are not currently sexually active. And change number 4 is the one most men do not expect, because it does not start in the body, it starts in the mind. Before we begin, subscribe for honest men's health conversations most people are too embarrassed to have. And tell me in the comments, where are you watching from? Now let's start by clearing up the biggest myth. Myth number 1. If you do not have sex for a long time, everything stops working. That is not true. The male body is more resilient than that. Your nerves do not disappear. Your tissues do not become useless. Your hormones do not turn off overnight. Your sexual function is not permanently lost just because there has been a long break. Many men can regain desire, confidence, and function after a period of inactivity. So if you have been single, widowed, divorced, recovering from illness, caring for a partner, dealing with stress, or simply going through a season without intimacy, do not panic. A break does not mean the end. But here is the part most men miss. The body does adapt to what it repeatedly does, and what it repeatedly does not do. That means long periods without arousal, erections, sexual touch, or climax may affect certain systems over time. Not permanently for most men, but noticeably. And the first system affected is blood flow. Change number 1. Blood flow may become less responsive. Erections are not just about desire, they are about circulation. When a man becomes aroused, blood flows into erectile tissue. This helps oxygenate the area, stretch the tissue, and keep it responsive. Even nighttime and morning erections play a maintenance role. They are not random. They help keep blood moving through the tissues while you sleep. So when a man goes a long time without sexual activity, and especially if morning erections also become rare, blood flow may become less responsive. You may notice it takes longer to become firm. You may notice erections feel weaker at first. You may feel less spontaneous arousal. You may start doubting yourself. And that doubt can create a second problem, anxiety. Because once a man starts thinking, what if it does not work? The nervous system becomes tense. And tension is one of the biggest enemies of erection quality. Here is the good news. For many men, this is reversible. Walking, strength training, better sleep, blood sugar control, blood pressure control, pelvic health, and gradual return to sexual activity can help circulation become more responsive again. But if erection problems are sudden, persistent, or happen along with chest pain, shortness of breath, diabetes, high blood pressure, or high cholesterol, do not ignore it. Erection changes can sometimes be an early warning sign of cardiovascular problems. Your body may be whispering before it starts shouting. And that brings us to the second change, the one most men never connect to sexual inactivity. Change number 2. Pelvic floor tone can decline. Most men do not think about their pelvic floor, but these muscles matter. They support bladder control. They help with erection firmness. They play a role in ejaculation. They support pelvic stability. and they help you feel control in your lower body. During orgasm, these muscles contract rhythmically. That contraction is like a natural workout for the pelvic floor. So when there is very little sexual activity for a long time, and if you are also sitting too much or not exercising, the pelvic floor may become weaker, tighter, or poorly coordinated. Some men notice subtle changes: a little dribbling after urination, more urgency, a weaker sense of control, pelvic tension, less intensity during climax. Many men blame age immediately, but sometimes the issue is not age alone. It is lack of muscular engagement, poor circulation, stress, and sitting for long hours. The fix is not complicated. Learn gentle pelvic floor exercises. Think of the muscles you would use to stop urine midstream. Gently contract, hold for 2 or 3 seconds, then fully release. Do not oversqueeze. Do not hold your breath. Do not turn it into tension. Control comes from coordination, not force. And if you have pain, pelvic tightness, or urinary problems, consider speaking with a doctor or pelvic floor specialist. Now, the third change is the one men feel emotionally before they understand it medically. Change number 3. Libido may become quieter. Desire is not just a switch. It is influenced by hormones, sleep, stress, mood, relationship status, confidence, blood flow, and habit. When a man has not been sexually active for a long time, desire may become less present in daily life, not because it is gone forever, but because the pathway is not being activated. The body often responds to patterns. The less you engage with desire, the quieter it may become. And then a cycle begins. Less desire leads to less activity. Less activity leads to less confidence. Less confidence leads to more avoidance. More avoidance makes desire feel even farther away. This is especially common for men over 50 and 60. They may say, "I guess I just do not need it anymore." Sometimes that is true. Some men are content with less sexual activity, but sometimes low desire is a sign of something deeper. Low testosterone, poor sleep, depression, medication side effects, diabetes, obesity, alcohol use, relationship pain, fear of failure. So the question is not only, am I having sex? The better question is, do I still feel alive, connected, motivated, and comfortable in my body? If the answer is no, your libido may be only one part of a larger health signal. And that brings us to change number 4, the one most men underestimate. Change number 4, confidence and mood can change. Sex is not only physical. For many men, intimacy is tied to feeling wanted, capable, connected, masculine, and emotionally alive. So when sex disappears for a long time, the body may be fine, but the mind may start telling a painful story. I am not attractive anymore. My best years are gone. No one wants me. I would probably fail anyway. It is safer not to try. This is where the real damage can begin. Not in the tissue, in the belief. A long period without intimacy can create emotional distance from your own body. You may stop seeing yourself as a sexual person. You may avoid dating. You may avoid your partner. You may avoid medical help. You may protect yourself from rejection by pretending you do not care. But pretending not to care is not the same as healing. And gentlemen, I want you to hear this clearly. Your worth as a man is not measured by how often you have sex, but your desire for closeness, touch, confidence, and connection is not something to be ashamed of. It is human. And if that part of your life has been quiet for a long time, you are allowed to rebuild it slowly. No panic, no pressure, no shame, just awareness and action. Now let's talk about what you can do if you are not sexually active right now. Step 1. Protect your blood flow. If you want better sexual function, start with cardiovascular health. Walk daily. Lift weights if you can. Control blood pressure. Control blood sugar. Improve sleep. Reduce smoking and excess alcohol. Manage cholesterol. The penis is a blood flow organ, so anything that improves circulation improves the foundation for intimacy. Step 2. Keep the pelvic floor active. Gentle pelvic floor training can support bladder control, erection quality, and sexual confidence. But remember, release matters as much as contraction. A tight pelvic floor can also create problems. So train gently and consistently. Step 3. Maintain some form of sexual awareness. If you are not with a partner, that does not mean you must disconnect from your body. For some men, self-pleasure can be a healthy way to maintain blood flow, sensitivity, and body confidence. But keep it mindful. Avoid rushing. Avoid excessive pressure. Avoid relying only on pornography. Focus on sensation, breathing, and connection with your own body. The goal is not escape. The goal is maintenance and awareness. Step 4. Check your hormones if symptoms persist. If you have low libido, fatigue, low mood, muscle loss, belly fat, poor sleep, weak erections, or loss of motivation, ask your doctor about checking testosterone and related markers. Do not guess. Get data. Low testosterone is not the only cause of these symptoms, but it can be one factor. Step 5. Do not ignore warning signs. Speak with a healthcare professional if you notice sudden loss of erections, no morning erections for a long period, pain during erection or ejaculation, blood in urine or semen, severe urinary urgency, burning urination, pelvic pain, testicular pain, profound fatigue or depression. These symptoms deserve attention, not fear, attention. Now, let me speak directly to the man watching who has gone a long time without intimacy. Maybe you are single. Maybe you lost a partner. Maybe your relationship changed. Maybe illness interrupted everything. Maybe rejection made you shut down. Maybe you simply stopped trying. You are not alone. And you are not less of a man. Your body may be quieter right now, but quiet does not mean dead. Your desire can return. Your blood flow can improve. Your confidence can be rebuilt. Your body can respond again. But it starts with not abandoning yourself. Do not wait until you are in a relationship to care for your sexual health. Care for it now. Move your body. Sleep better. Eat for circulation. Train your pelvic floor gently. Check your hormones. Address stress. Talk to a doctor when something feels wrong, because sexual health is not separate from men's health. It is one of the clearest windows into your overall vitality. So what really happens when you do not have sex for a long time? For most men, nothing catastrophic, but blood flow may become less responsive. Pelvic floor tone may decline. Libido may become quieter. Confidence may take a hit. And hidden health problems may become easier to notice. The good news? Most of this can be improved. Your body is adaptive. It responds to movement. It responds to circulation. It responds to better sleep. It responds to confidence. It responds to care. So do not let shame make the decision for you. If intimacy has been absent from your life, use that as a signal to reconnect with your health, not as a reason to give up. This is Melissa Carter. If this video helped you understand your body more clearly, subscribe for more honest men's health conversations. And tell me in the comments, how long do you think men can go without sex before they start worrying? Because the answer may surprise more men than you think. And remember, you do not lose your vitality in one season of silence. But you can lose confidence if you stop listening to your body.